Hi, I'm Dr. Anjanette Wyatt, and I am coming on today to start posting videos and sharing with America what's going on in healthcare. Um, I'm a patient advocate, and I want to help the average American understand healthcare and how to advocate for themselves and their loved ones, and how the system is designed for your health to fail, designed for you to not be successful in disease state management, and that's something that you have to own for yourself and your health, because nobody's going to care about you or your loved ones more than you and your loved ones. So if you think that other people are going to care more about your well-being than you, or more about your mom or your dad or your children than you, then you're sadly mistaken. Everybody needs to understand that healthcare involves you. And I want to empower you with knowledge so that you can go out there and fight for yourself and fight for your loved one. So this video is going to be brief, but it's going to be about empowerment. And I have been saying that I'm going to start this, I'm going to talk about this ever since COVID, because back when COVID occurred, immediately I had colleagues calling, Anjanette, what do you think? What do you think? Is it going to be a month or two, as we've been told by the media and by our administration, the administration? I said, absolutely not. We're looking at 1 to 2 years at least of isolation and quarantine and all that. They couldn't believe me. They were like, what? 1 to 2 years? But they're saying in the news that it's going to be a month or it's going to be a couple months. I said, don't listen to that. It's going to be 1 to 2 years and maybe even more. So, of course, it came to pass that we were in quarantine for over a year and more. And vaccine didn't even come out till a year after COVID really, came to America. But guys, everybody wake up. We have to take care of ourselves out here. We have to cling to what's real and not what you hear or see on news or on the TV. Many people lost their lives during COVID, and they could have been here. So just to give you a background, I had COVID 3 times. But the first time I got COVID, I didn't have a vaccine yet, and I almost lost my life. If it were not for me being in the medical field, being a pharmacist, knowing what I needed, then I would have been put in a body bag. I want you guys to know when to say no, or how to advocate for yourself. So when I got COVID, I got it in the early part of 2021, right when the vaccine came out, but I hadn't gotten it yet. Medical professionals could get it, but I just hadn't gotten it yet. And because I was, overweight and had all of the predispositions to having severe COVID, I got it, and I couldn't breathe. My oxygen went down to like 70, and my daughter had to call the paramedics twice for me. And both times the paramedics came and said, we have to take you to the hospital. We have to rush you to the hospital. You can't survive. With an oxygen level this low, you're going to die in your sleep. And I insisted that I was not going to the hospital. So they brought me oxygen. And the first set of paramedics, they put me on the oxygen, brought my oxygen level up. But they said, ma'am, as soon as we leave, you're going to plummet again because you have severe COVID. And I said, I'm not going to the hospital. It was during the freeze. And if you guys remember, the freeze was very bad. The hospitals and the ERs were crowded and flooded with victims of the freeze. I refused to go. And so they said, well, we can't force you to go, which they couldn't, but I was in a bad state. So, of course, after they left, my oxygen plummeted again, and I immediately tapped into my community, which is the medical community, my physician and a lot of brilliant physicians that I know, and pharmacists that I know in the United States. And we, at the time, they really didn't know the right regimen to save people, but we knew, those of us who are in the community knew what was needed to bring on board immediately. And that's what we went full-fledged into doing, getting me the medicines that I needed at home, not in the hospital. Subsequently, my oxygen level went down even further. My daughter had to call the ER again. The 911 again. Paramedics came again. Luckily, these two paramedics were different from the other two. I told them I'm in the medical field. I told them I'm Dr. Anjanette Wyatt. I told them everything about me. And one of them said, hey, let's make sure she has oxygen. They call FEMA. They call out all the big dogs to come out and help me. And they also left the oxygen tank for me. They actually said, we're not supposed to do this, but you are in the medical field. We do not want to see you in this state. And we're going to do this and make sure you have oxygen until FEMA comes in and bring you the big tank and everything. And I promise you guys, every night I knew that I was at the brink of death. Every day I knew that I was at the brink of death. When I would go to sleep, I would see my dead father, my dead uncles, my dead grandparents. Everyone on the other side was with me when I would doze off. And I was in their land at that point. Even to the fact that one of my uncles, because I was asking them to help save me, and I was just asking them for help, and I didn't call one of my uncle's names. So the next night when I went to sleep, my uncle came to me and said, hey, you didn't talk about me, you didn't call me, I can help you. And I said, I'm so sorry, Uncle Jimmy, I forgot to call your name. And this is all happening like in my subconscious state, right? So it's just amazing what the real world, the world that we live in and the other world, and how they see everything that's happening to us. They were watching over us. They are, looking at us and talking to us, but that's another conversation, right? But I was able to get that medication that we had decided would be my regimen and start it in my system. And this is not the regimen that was being promoted and given to people in the hospital, or even those at home. Nobody was helping people. They were dying unnecessarily, in my view, because they weren't getting the right drugs. Basically, they needed certain drugs before COVID took over their whole system. And I'm fortunate enough to be able to sit here and tell you that if I did not advocate for myself, if I did not call and make sure that those who could help me actually intervene and help me, and I got the right meds in my system, I would not be here talking to you today. Also, had I allowed them to take me to the ER, I would have been put on a respirator, put in the ICU, and most likely not have come out alive. And I know a lot of people in the medical community say, don't tell people that. I'm like, I'm just here to tell you the truth and give it to you raw and unfiltered, because somebody has to let the public know what is going on in healthcare. Someone has to say, yes, there are wonderful doctors out there, wonderful nurses, great people, wonderful pharmacists, and all of the supportive staff that we depend on, the nurses' aides, the patient care individuals, all of those people, the pharmacy techs, the PAs, and everyone is working together to save you, but they are having to fight an uphill battle with insurance companies, with reimbursements, with not being able to make sure that you have access to your medications. I want to ask you this: if you go to the doctor or you go to the hospital, the doctors say you have XYZ disease state, or you have diabetes, or whatever, you have heart condition, whatever. How on earth are you going to get better if you do not have access to your medications? It is the medications that get into your system and change the trajectory of your future, or your outcome, or your prognosis. So without the medication, you can't recover. Without having the right medication, the likelihood of you recovering, it diminishes. So we as Americans have to stand up and say, look, we need access to our medications, okay? Especially those in rural areas and areas that don't have as much access as urban areas. We gotta stop allowing this country to not have us have access to our medications. Also, I want you to know that when you're in a hospital, you gotta have someone with you. If you go to a hospital ER and you're in that room, then your family should take shifts being with you. One takes shift morning, evening, overnight, morning, evening, overnight, because what is happening to you in a hospital, someone needs to be there to know what's going on. And if you can afford to have a patient advocate like myself that understands the lingo, understands what's going on, and that can help you navigate through that with the medical professional. I just had a case yesterday, where they're trying to put this young lady out of the hospital when she's not able, ready, or her family isn't even ready for her to be out of the hospital. She's not at the state that she needs to be discharged, but they're discharging anyway. They will push forward with discharge if you allow it. When the patient is not ready to go home, they're still on IV therapy, but they're trying to push you home. Why? We pay these great, huge insurance premiums, but when it's time to utilize the insurance, people don't understand the cycle. They don't understand how long you can stay in the hospital and then how long you have to be out before you come back in. There's a lot that goes on beyond just going into the hospital and getting out. Some people, if they have a chronic condition or whatever, or if they have a life-threatening condition, they stay in. But the goal is to move you on and get that bed free. But your goal as the advocate for the patient should be, is my loved one ready to go home, or are they going to go home and get worse because, social work and all the different factors of this discharge process is not understanding the need of the patient, and they're just operating on protocol and on pressure from either the hospital or the insurance company to move the patient on once they are considered stable. And I put that in quotes because everybody's not stable when they say stable. And you have the right to say no, we're not leaving today. A lot of time discharges are pushed on a Friday. They want you to get out, which was today's Saturday, so it's yesterday. By the way, today's Saturday, September the 6th. And 2025, by the way. But I want you to know that you have a right to say no. And you have a right to say my loved one is not ready. Okay? So stay tuned for the next video so that I can tell you how to push back and keep your loved one safe until they are actually ready to go home and you have the support at home to keep them alive and safe. Stay tuned. Stick with Dr. Wyatt and you will save your life and your loved one's life.